Hi, I'm Dr. Arpana Shah, board certified dermatologist and Kayura's skincare expert. I'm thrilled to be here today to answer some of your most common skincare questions and offer some simple, science backed, healthy skin tips. So let's get started. Our first question is from Carell, and she asks, how do you keep dry skin moisturized? Well, the key is to help repair and protect that skin barrier. And you can do that by using a gentle cleanser, moisturize right after getting out of the shower. So while the skin is still damp, and then to avoid overtly harsh hot showers or harsh exfoliation. These simple measures on a consistent basis will help to keep the most dry skin moisturized. What's the best routine for treating hyperpigmentation besides the use of sunscreen? Well, consistency matters more than applying too many products. I like using antioxidants such as vitamin C and brightening serums such as tranexamic acid that can help to fade discoloration over time. Both of these products are found in Kayura's Karma Boost and Bright Aura, and when used with sunscreen, can help achieve optimal results in the battle of hyperpigmentation. This is one of the most common questions I get every day in my dermatology practice. Should we wear sunscreen even when indoors? And the answer is absolutely yes, especially if you are sitting by a window, driving, or use products such as exfoliants or retinoids. UV rays can penetrate through glass, and daily sunscreen is our best anti aging habit. So make it a routine. Use a sunscreen every single day, and I promise you, your future skin will thank you. The next question is a great one. Can we actually prevent aging of the skin? Well, to understand that, you must know that aging is a natural process. The goal is to age healthy, not stop it completely. Daily sunscreen, antioxidants, and healthy lifestyle habits such as not smoking, minimal alcohol, eating healthy, avoiding overprocessed foods, and exercise are all simple ingredients in a recipe to help our skin age gracefully. So many skincare products nowadays are slated for dry skin, oily skin, combination skin. How does one determine what type of skin you have? Well, overall, dry skin tends to be itchy and feel tight. Oily skin will make you look shiny throughout the day. Combination skin, you may feel shiny or oily in the T zone, but drier in other areas. And sensitive skin tends to burn and sting and itch. In what order should products be applied to your skin? Well, I am a big fan of layering, applying small amounts of different products in a particular order to help provide optimal results in healthy skin. I start with the thinnest products and move on to the heaviest. That usually means a mild cleanser, a antioxidant serum, a mild moisturizer, then sealed in with a SPF sunscreen, which is closest to the sun. And our last question comes from Elise. I'm 26 and I've never been to the dermatologist. Should I go preventatively? Well, Elise, the short answer is yes. If you have any concerns about any moles, freckles, rashes, any other parts of your body, or just want to learn more about how you can help protect your skin and maintain healthy skin throughout your life, go visit your dermatologist. Dermatologists can offer you valuable experience and education on what to look for and help prevent many dangerous skin cancers from getting too far. Melanoma, the most dangerous skin cancer that there is 99% curable if caught early. Therefore, if you have a family history of melanoma or other skin cancers and want to be seen preventatively, that is absolutely something that a dermatologist will do. So, to great skin health, see your dermatologist on a routine basis.